I'm thrilled to introduce our next speaker, Dave Vautin from the Metropolitan Transportation Commission. When I say I'm a recovering transportation planner, I used to work at the agency Dave now works in. It's been 5 years. I think they do, honestly, some of the most innovative, interesting, cutting-edge work in the country, and so we're thrilled to have Dave with us. As I said, we wanted to kind of come from the morning's higher-level discussions around sort of the national perspective, a little history of transportation planning engineering, how we got ourselves into this mess, to a bit of a local response panel here. And let's now transition into, and I think get into the rest of the afternoon, what would it mean for PSRC in particular, the Puget Sound Regional Council, to truly integrate and elevate health into their planning. And I think we've got a great example here from another sister agency down in the San Francisco Bay Area about exactly how to do that. One analogy that I like to think of, because boy, transportation plans can be dense and wonky and hundreds of pages, and then you've got the EIR, which is even bigger. That's environmental impact review for those of you at home. I like to think of this and liken it to a food nutrition on something you buy, right? A food nutrition label, right? So for a long, long time we said, okay, here's our new 20-year transportation plan. Well, what does it do for the region? Well, just read it, you know? Read the hundreds of pages. But if you actually had a nutrition label, because you're busy people, you've got places to go, and actually said, here's what this will do for the economy, for the environment, for access to jobs, for low-income people. If you had something that would actually tell you, and even give you some options, some scenarios, and tell you which projects did more for health, did more for congestion, did more for all of these metrics that we're talking about, in particular, of course, health, I think you'd all have a much clearer sense, a more transparent sense of the options that you had in front of you in terms of where to invest limited resources and limited dollars in this region, right? So that's what we're going to hear about next from Dave. We're going to have Jeff Hobson from Transform join us. Jeff is with the Regional Advocacy Network in the San Francisco Bay Area, who did a lot of work on this plan. So we're going to hear from Dave Vautin next, and he'll turn it over to Jeff. So Dave, take it away.
Thank you, and good afternoon, everybody. As has been mentioned, I am with the Metropolitan Transportation Commission. We are effectively the same as the Puget Sound Regional Council. We're the MPO for the San Francisco Bay Area. And what I want to talk about today is really the implementation of a lot of the ideas you've been hearing. So I do apologize in advance for going down the rabbit hole of all the planning and wonkiness that entails. All this health stuff that you've heard about, we see it a natural home for that in a lot of the performance assessment work that we've done in the Bay Area. Quantifying these measures, trying to use them to communicate the benefits of projects is really critical. So what I want to do today, there's 5 parts to my presentation. I want to start at a very focused level and talk about the actual measures themselves. You know, what sort of targets have we set in our region for health? How have we incorporated that into our existing frameworks? And I want to talk about how we use those measures to assess scenarios, to assess projects, highlighting how we don't just produce the data, but we try to tie that in as an effective way as possible to decision making and policy. And then I'll close with a brief discussion of some of the new tools that are available. It's very exciting right now as we look at the connections between health and transportation, that there are tools available that make this easier than ever. So starting off with target setting, we all recognize the importance of health and equity. For too long, we've used measures that are proxies for these issues, right? So we look at issues like transportation mode share, and we say, well, if we get mode share up, we're improving the health outcomes. But we got to move beyond those proxies. We need to look at the actual end goals. So I want to start off this section by talking about why performance is so critical and why we integrate health into the performance framework. This chart here shows the 20 biggest metropolitan areas and their MPOs across the United States. And we did a survey back in 2012, 2013, looking at their long-range plans and seeing how they spent their money. And what you can see is very large number of metropolitan areas are spending the vast majority of their money operating and maintaining the existing system, and that the amount of dollars left over for expansion projects is continually dwindling. And this means a lot of things. One really important thing about it is that the smaller the share for expansion, the lesser the ability of the agency to really change the status quo. And so you can see MTC here, we're spending 87% of our regional transportation funds operating that system that we already have today. So that means we need to be really smart about the 13%, and we need to make sure that we're carefully looking at the health and equity outcomes from those limited expansion projects. So because of that, we've integrated performance and this idea of assessing measures, setting targets, doing it in a consistent way across different levels of analyses. So you not only are doing it for scenarios, but for projects, you're doing it for your EIR, it's consistent and throughout, and you're monitoring the progress of the plan. It's not something that's new to the Bay Area. We are about to start our 5th cycle of a performance-based long-range plan. We've been doing target setting for a lot of these transportation measures since the 2001 long-range plan. This is something that's very unique. So most MPOs in the country have measures. We have measures plus targets. So what this means is that there's a numeric goal associated with it for a horizon year of the plan. We also have really gotten into project evaluation. I'll explain why that's so critical. Transitioning from a very qualitative assessment to a very quantitative one. And opening up the number of projects that are being assessed in this process. So not treating the vast majority of projects as committed or exempt from analysis. A lot of the health work that I'm going to talk about today was integrated into our plan for the first time with this latest plan known as Plan Bay Area. This plan's unique for many reasons. First of all, it's the first regional plan that integrates land use scenarios with transportation. It's the first regional plan that looks at housing issues. And it's the first regional plan that has a mandatory greenhouse gas emissions reduction target as a result of a California law known as Senate Bill 375. So we have all these new aspects of planning going into this process, and we want to integrate health and equity into it more deeply. We started off with a very collaborative process. We have a lot of stakeholders in our region, 7 million people, 9 counties, 101 cities. We spent 6 months defining the measures and the targets. And part of the reason why this took so long is it wasn't very hard to create a wish list of performance measures. It's a lot harder to figure out which ones you can evaluate and which ones you want to evaluate. We had about 90 performance measures on the table. We had a mandate to find 10 best and the 10 most important to the region. And what we required folks to do is really assess trade-offs. What measure would you eliminate if you want to add a new measure into the mix? We also spent 8 months coming up with this project evaluation framework that built off of those measures, those targets, and then allowed us to analyze individual transportation projects. And the benefit from this is we had folks on the left and the right supporting this performance framework. Now, how to set targets. I wanted to get into the weeds a little bit here before we get into the project evaluation and the broader policy discussion. One of my specialties is performance measures and choosing smart measures. And I'm going to show a couple examples of different issue areas. So we had identified health was something we wanted to look at more carefully this time around. I would categorize performance measures as of really 3 core types. One is infrastructure oriented. So in the case of health, perhaps the lane mileage of bike facilities that you're constructing. That's an okay measure. It reflects what the agency is doing to try to deal with that issue. But it says nothing about the use of those facilities. It says nothing about whether customers are going out there and bicycling on the bike lanes. And it doesn't really get at the reason why you're building bike lanes in the first place. So then there's measures that are more customer-oriented or user-oriented. This was the measure we used for this plan, increasing the daily time spent walking or biking by 70%, so getting folks up to about 15 minutes per day across the region. Now this measure is, again, a little bit better, gets at the customer needs, but really doesn't get at the core issue. And so that's, in an ideal world, you want to look at something like an objective-oriented measure, looking at the mortality, the morbidity impacts of insufficient physical activity. And as models have become more advanced, when we started this process, the ITHM model that I'll talk about later it was still in the UK. It didn't exist in the United States. So we had to use the best available measure. And so what I want to emphasize with all this is it doesn't mean that you necessarily can jump to the objective-oriented at the very beginning, but you need to set yourself on a path to progress to better and better performance measures over time. The same thing goes with equity targets. So, a very standard measure, what percent of dollars are going to disadvantaged communities? Well, that's okay, but that says nothing about the impacts of those communities. Or maybe something related to accessibility for folks in those communities. But really, in the end, we want to go with something more objective-oriented. We want people on transit, living in those communities, to take transit because we want to make it a more affordable region for them. And finally, on the air quality, again, the difference between a measure like something like the fleet makeup, transitioning to something like emissions, and then in our latest plan, we looked at the deaths from those emissions, so getting at the real objective. We think it's very important to talk about the real health impacts and the impacts to people. It's certainly more interesting than tons of particulate matter in the air. I'll also note that we looked at, that this was one of the classic examples where we looked at health and equity intersecting. So we had a sub-target for this that looked at whether particularly disadvantaged communities were experiencing a greater burden from particulate matter and whether we were achieving greater reductions for those locations. Now, those 3 measures are 3 out of the 10 performance measures for our long-range plan. Each one of these has a numeric target, as I mentioned. And it goes into this very sustainability-oriented framework. So you can see 5 of those 10 measures really dealing with the environment, 3 of them related to the economy, and 2 related to social equity. What's very interesting here is public health was added to this for the first time. The active transportation measure, that was something that was new. But we dropped a couple measures along the way, and one of them that we dropped was anything related to congestion, related to travel time reliability. I think this makes MTC one of the few metropolitan areas in the country that does not have congestion reduction as a transportation performance measure or target. We've actually decided to focus more on getting folks out of their cars and providing those alternatives to the automobile. We also had 5 other measures that were specifically designed to look at whether communities of concern, these lower income or minority neighborhoods, were having disproportionate impacts. So we looked at issues like affordability, risk of displacement, density of traffic volumes, and then travel times to understand what was going on. We used all these measures, the 10 performance targets plus the 5 equity measures, for every scenario that we studied. And we studied 14 different scenarios through this process. So now I want to talk about the scenario analysis and why we focus so much on projects. So here we go again. We did the targets on both the projects and the scenario level. It was more of a quantitative effort for the scenarios. It was more qualitative for projects. We had this benefit cost analysis and an equity assessment that fed into the process as well. And we have these results. So frankly, in my mind, 10 targets is actually almost too much for our policymakers. I've known some MPOs have 80 of these targets or measures. These slides here show some of the results from the performance measures. And what I want to highlight is interesting. There's really 2 things. One, you're seeing the results for 5 of those 14 different scenarios studied. There's some light shading here indicating some of the targets that were achieved, others which we fell short on, and in red, some of them that we actually go in the wrong direction. And what's really interesting is how similar these scenarios that have different priorities, some much more into highway construction, others much more into transit, performing pretty similarly. I mean, we see the transit ones perform slightly better, but they're all about the same. And the problem here is that when you build scenarios, you often bundle projects where you bundle the good with the bad. So if you build a transit scenario, you have that transit line that may not serve very many people going to a low-density area, bundled in with a high-capacity line in the dense urban core of the region. And you're not able to differentiate which are the best projects from each category. You can also see here, target 7, the equity target, actually showing all of the scenarios making the region actually more unaffordable for lower income communities. And we did the same thing. These are just 2 scenarios showing the various communities of concern versus the rest of the region. And you can see there are some slight differences, but again, there's not a huge difference between these scenarios. So this causes us to think, and we've thought about this and we've moved more and more towards it. These scenarios aren't telling us much. They're not helping us create a better preferred scenario. We need to get into project level evaluation, a consistent evaluation across the region. So once you decide that you really want to get into project evaluation, the question comes up, well, what projects do you evaluate and how do you evaluate them? This slide here shows there were about 1,100 projects in the Bay Area that were submitted for inclusion in our plan. We've made this red slice, the committed projects that are exempt and automatically included in the plan, smaller and smaller over time, to the point now where it's really projects that are about to start construction, and so we want to recognize those as committed. But the vast majority of projects, even those that have been voter approved, they may have some sales tax money associated with them, those are on the table for evaluation. And we know that there are 900 of those projects, but the vast majority of the money is in the 100 or so biggest projects that we're evaluating. That's about $150 billion of transportation investments. So we decided, let's focus really heavily on that. Let's do something quantitative for that. So we developed two different assessments. So first of all, you have those targets. We do kind of a qualitative assessment on those issues, which include issues like health and equity and greenhouse gases. And we do all of the uncommitted projects. And then for those 100 major capacity increasing projects, let's do a benefit cost assessment. And the way we do this is we do not just ask the sponsor how many riders they think their project is going to result in. We say we want a level playing field. We don't want to compare apples and oranges here. We want to understand how your project performs in a fair comparison. So we run our travel model for each of the different projects and calculate their time and cost and health impacts so we can understand their cost effectiveness in a consistent manner. So this is just showing here again these target scores that are more qualitative. Each project has a score ranging between +10 and -10, depending on whether it supports or adversely impacts each of those targets. And then we had a benefit cost assessment that relied on our travel model, and we added in a lot of new benefits this time. We added in, using a sketch planning tool, some of the health impacts from active transportation, collisions, emissions, obviously time and cost as well, and use that to calculate the benefit cost ratio of these projects. Now I'm going to show a couple slides of what we call the bubble chart, and these are how we summarize project results for policymakers. So on the horizontal axis you can see the target score, that qualitative assessment of these projects, ranging from +10 to -10. And then on the vertical axis you have the benefit cost ratio. Now, what the bubble size shows you is kind of the scale of the project, to give you a sense of the size of its benefits. What you see here on the road projects is we were able to identify some high-performing projects in the upper right quadrant. Pricing projects like a cordon around the city of San Francisco to generate new toll revenue, as well as a freeway performance projects or ITS improvements. And on the left side there you have a handful of capacity increasing road projects that might have some adverse impacts on those targets. We did the same thing with public transit. So here we have all the transit projects. And you see this range of projects from really high performers like bus rapid transit lines or improvements to our heavy rail BART system. And then some lower performers in the bottom right there that didn't meet the benefit cost threshold of 1. It helps inform us really about the distribution of projects and where they land. And then this is the summary, kind of the aggregation of all those projects by type. Again, you see the high performance of pricing and ITS, the strong target support of transit, and then perhaps some of the adverse impacts of hot lanes and freeway expansion in our region. So what does this tell us? This slide here is really illustrative because, as you saw, there was a vast distribution of performance, but when you aggregate them together, you don't get the full picture. And so we really have gotten into looking at these projects on an individualized level. Now we can do the same thing with all these benefits. So not only do we have these summary materials, we have pages and pages of data about all these projects that we've calculated. And you can go look up for any of these major projects, how much money do they save for folks, how much time, the number of active individuals, the tons of emissions, all that. I've highlighted the top 3 and bottom 3 projects for cost effectiveness for health benefits from active transportation, so walking and biking. it was a very interesting result to us. Of course, a lot of the freeway projects, which discourage auto and walking and biking trips, were particularly cost ineffective to improve active transport. But you actually see an interesting distribution here. So at the top you have projects like our BART Metro program, which is a frequency boost to the heavy rail BART system, generating a large number of new active individuals. People are walking and biking to their BART station, taking advantage of those fast-moving trains to get to work or wherever they need to go. And also some pricing projects that really get people out of their cars. So these are projects that get people out of their cars. We also saw some transit projects actually having adverse impacts to public health. This was particularly interesting to us. One of the projects that's actually one of the highest performing projects in the region is known as the Transit Effectiveness Project. It's designed to boost the speed and frequency of our Muni bus system in San Francisco. It has great benefits for mobility. But when we did this analysis, we found that it actually reduced physical activity. Now, why was this? We were able to identify that the biggest competitors to Muni, when you boost its speed by a few miles per hour, is actually walking and biking. Our Muni buses run about 7 miles per hour. You can definitely beat them on a bicycle, I guarantee it. And you can sometimes beat them walking. And so as we speed up Muni, it has great benefits. People are getting where they need to go faster, but it might also have some drawbacks. So adding health into the mix can tell you more about projects that should be considered in the spectrum of many other important benefits, transportation projects. We also did this equity analysis to look at the impact and geographic location of various projects. Here you can see them overlaid with various communities of concern. So what I want to get to next is we're not just pushing out this data. We've made a very concerted effort to increasingly inform policymakers and help guide them in decision making. And what we decided to do this time around was categorize projects into 3 bins. So we said, let's focus on the highest performing and lowest performing projects and make a concerted regional effort to do something about these. So for the high performing projects, we set aside a share of the funds in the long-range plan for whatever projects were identified as high-performing. And once we identified them, we tried to line up the funding sources, so we created a new priority list for our New Start's federal transit funding priorities. That was 13 projects. We also had some low-performing projects. There are about 30 of those. And those are down here at the bottom. These are projects that had a benefit-cost ratio that was less than 1 or an adverse impact on the target score. So they were perhaps sprawl-inducing projects. And then there were projects in the middle that we said, let's let the local agencies who know the needs best, let's let them prioritize those. Let's really focus our regional efforts where we can be most effective. So what we did is we set up what we called the compelling case process. And we said, if you're one of those high performers, we're going to work on the funding. We have a separate process for you. If you're a low performer, we want you to go through this process. And you're going to need to submit a case identifying what about our analysis, what shortcomings in our analysis resulted in your poor performance, and what we're missing. And if you can make a strong case under these criteria that we had approved by our commission, then you could be included in the plan. If not, then you were going to be removed from the plan, and you would not be able to construct your project for the 4-year window of the plan. So for these 34 projects, 8 of them were able to make one of these cases, mostly on the grounds of social equity, serving these lower income neighborhoods. We had 13 other projects that really rescoped their project. They agreed to just do an environmental study, they agreed to contribute more local dollars to the project, and then 12 projects were withdrawn. So we were able to eliminate some of the projects that perhaps had were less cost effective and less supportive of regional goals. I want to conclude by talking a little bit about ITHM and about some of the opportunities with health and equity. So we integrated health and equity into this very robust performance framework. And again, it's a very important piece of that puzzle that we need to be focusing on. The expectations for what we do with performance, the amount of data about projects, they've grown so significantly. The public expects more from us than ever before, and so do policymakers, both on the local, state, and national levels. MAP 21 is going to create this new performance framework for MPOs and state DOTs, but it is a very traditional framework. It's a very highway-oriented framework. And there's no national mandate to create performance measures for equity or public health. So it's really up to us on the regional level to do something about it and to lead the way. And given the political makeup in Washington, D.C., I wouldn't expect the new authorization, at least for a few years, to incorporate those sorts of more sustainability-oriented or health-oriented measures. Just a quick word about IFM, this integrated health and integrated transport and health impacts model. For our last long-range plan, IFM hadn't even been calibrated for the U.S. or for California. So we had to work with what we had, sketch-level tools, existing model outputs that tell us things about active transport or air quality. But now there is this tool. It's been calibrated for the Bay Area. A lot of MPOs across the country are looking into using this sort of tool. And it helps inform us about really three types of health impacts. We're looking at the mortality and morbidity from air quality, physical activity, and collisions. It puts all of those impacts into a consistent set of metrics, looking at the disability-adjusted life year impact of projects. And it integrates with existing travel demand models and GIS databases. So it's building off of things we already have with kind of an Excel-based tool. The graph on the right side there is particularly interesting. So one of the big issues related to greenhouse gas reduction, which is now the top priority for regional transportation plans in California because of Senate Bill 375, so is reducing greenhouse gases, right? One of the most popular strategies for that is clean vehicles or electric vehicles. And that really does help with greenhouse gas emissions, but it doesn't have the sort of health co-benefits as building new bike lanes or improving communities and making them more walkable. So we looked at two different strategies. This is from a journal paper by some MTC staff and Neil Maislish of the California Department of Public Health. What you can see here is the difference in those strategies, an active transportation strategy and a low-emission vehicle strategy. And from a health impact basis, the active transport strategy is the clear winner. Even though there's some increased collisions as a result of more folks walking and biking, the physical activity benefits more than compensate for that, and it's just so much greater than low-emission vehicles. And this health co-benefit is why we need to have both a GHG measure and a health measure, because we need to incorporate strategies both to get those cleaner vehicles, but also to make our communities more walkable and bikeable. So just some concluding thoughts. First of all, integrating these health and equity measures into regional and state performance frameworks is a critical step. And it really can be beneficial for your region, I think, and for many regions. It's an issue that we all care about very much. Focusing on outcomes rather than proxies leads to much more meaningful results. I don't think any of us go home at night and think, gosh, we really should reduce those tons of particulate matter. No one really knows what that looks like. But if we talk about people's lives and the health impacts, that's just so much more important and meaningful to the average person. It's essential to move beyond scenarios and look at projects. It is a lot more work. I'm not going to try to say that it's easy, but it is just so important. And shifting that focus to the project level can create a much better preferred scenario. And then finally, I'll just end with a very optimistic note, which is there's been so much progress in the last few years on these health and equity tools for transportation planning. And so I expect that level of inertia to continue, and doing this is becoming easier and easier. So although it is a process and it takes years to integrate these sorts of things, the tools are there, and I hopefully you all will be able to leverage those here in the Puget Sound region. So before I go to questions, I want to introduce Jeff Hobson. So he's the Deputy Director at Transform, which is one of the advocacy organizations in the Bay Area. I've known Jeff for a number of years. He was very involved in Plan Bay Area, and I know he wants to come up here and just say a few words about the process.
Great. Thanks very much, Dave. So I'm up here today. I think my role is to be the rabble-rousing advocate who's here to tell you that a government agency did a good job. And I'll give a little bit of my own true confessions here. Like Mr. Tumlin, I am from the Bay Area. I was born in Los Angeles, UCLA Medical Center, and my name is Jeff. But my family is from here. Tacoma, Bellingham, Pullman, Portland, Seattle, teachers, all of them. So I'm very happy to be back up here, even though I am raising a child who really doesn't like Richard Sherman or the Seahawks, period. So I'm with Transform, and which is a nonprofit organization in the Bay Area. We believe that you can't get ahead if you can't get around. And we want everyone, regardless of income, to be able to afford to live in a place where they can walk out the door and find a variety of ways of getting where they want to go, safely, affordably, reliably. And that's why every day we work with a diverse range of partners to win policies and funding that will promote walkable neighborhoods with excellent transportation choices. And so we've worked on 5 of these regional transportation plans that Dave was just talking about. And I'm here to tell you that the last one, this 2013 plan, was the best. And a big reason for that is that MTC, the Metropolitan Transportation Commission, they truly embraced performance-based decision-making. And they measured the right things, or at least they measured many of the right things. There are still steps to go to make it better, as Dave said in his conclusion. So I won't get into much detail about that, but happy to in questions if people are interested. But I think there's a few things that they did well. One of them was to have a very open process. There were technical advisory group meetings that went into very minute detail that had a wider range of people in them than ever would have been true before in previous processes. They were not afraid of having us and others come in and say, why is that the right valuation of congestion, and to figure out what the right valuation was. And so they were very open. They also valued the right measures. They put monetary value in those benefit-cost ratios on things that hadn't been valued in previous plans. For example, reduced healthcare costs from walking and biking. Those 2 bars that you saw, that's something that, in that last example, that's something that would not have been considered as part of the process, except in a sort of, oh yeah, we know that it's better if people walk and bike, but we wouldn't know how many fewer people will die because we are making it easier for people to walk and bike. A third thing was that they used these targets to do a qualitative assessment of all of the projects, and they really thought about all 10 of those targets. How is this project going to improve walking and biking, or how is it going to hurt it? And that leads to the fourth thing they did very well, which was to admit that transportation projects cause some harm and some help. And let's look at the balance between those. All too often, we have graphs that show us how much it will do to qualitatively advance the targets and what the quantitative benefits will be. And maybe we do an analysis of costs and benefits and a benefit-cost ratio, but rarely do you see a transportation agency recognizing, yes, this project is going to mean that more people are going to be hit by cars because we have more bike lanes, but at the same time, so many more people will be bicycling that there will be so much more physical activity benefits that it's better anyway, or it's worse, and that project should be kicked out. So another couple of reasons: much better communications than ever before, providing a lot of detail as well as putting it together into good summaries. And then being honest about the shortcomings of these plans. And that honesty is really important because the agency needs to be, and MTC did a good job of being clear when they could model things and when they could not. And recognizing the model is not reality, and it's hard to predict the future. And so we should recognize which direction the model is making mistakes in. And so there was some acknowledgement of that. I think we would like to see a little bit more of it, and there are ways in which we think the model and all of the performance-based planning that MTC did can be done better. And the thing that I think, want to most say from the advocacy perspective is we feel like we have a really strong partner in the agency at MTC in trying to figure that out, and in trying to figure out, I felt like we were really dealing with scientists who wanted to get a better understanding of how to make a better plan. And so we've taken a lot of lessons from this experience and the other campaigns we've done for the last 17 years of advocacy in regional transportation and land use planning in the Bay Area and across California. And we put it together into a best practices library that there's a little flyer up here you can get afterwards. Being an advocacy organization, I have something for you to take away and go do, which is read. It's on our website. It has information about community-based transportation plans and safe routes to schools programs and how you can get started on implementing those. And so we're very much looking forward to this conversation. I'm delighted to hear how the Seattle and the Puget Sound region is going to make advancements in making better connections between health and transportation and equity. Thanks.
Great. In spending a good 10 years down in the Bay Area, we thought it was really important to bring in both Dave from the agency, obviously, and the advocacy perspective, because in many ways, this is really, I think, in some ways, the future of how decisions get made and how things get moved, and that risk, I think, of agencies taking risk and being pushed, and the advocates being there, sort of almost as equal partners. We've got a couple of minutes. I did want to make sure that we get a chance for questions, either for Dave or for Jeff. I know that they threw out a lot of somewhat quantitative information to you, but I'd love to get any questions for Dave. Yeah?
Yeah, quick question. I'm wondering if you could talk a little bit about the governance structure at MTC and how shifting to kind of a new model of project evaluation, how that was seen by those in charge, and what case was made either by the advocates or by staff from within to help make that change happen.
So just a quick overview of our governance structure. We have 3 commissioners from our largest county, each of our largest counties, 2 from the medium-sized and 1 from the smaller-sized county. So it's a kind of a modestly sized board. I would say about 15 to 20 people. In terms of the policy challenges, it was successful because we rolled it out over a series of years, right? So we didn't just jump into this at the first time. It started with a simple qualitative assessment, and then added in a simple benefit cost, and this time we ramped it up. We ramped up the compelling case process from, in the past it was, there was no process. Then it went to a simple letter in which all the letters were approved by the commission, to this time where there were actually some teeth to it. There were some policy controversies over things like which projects should be evaluated, and there were debates, and advocates were there. Certainly, one of the contentious issues was the fact that we were evaluating projects that were voter approved. A lot of times, the sales taxes in the region put money towards projects, but they only fund 10% of the project. And our policy position at this point is really that we want to evaluate those. They need regional dollars. So there were certainly some challenges in the process, but I think overall it was one of the least contentious parts of our process. There were a lot bigger debates on issues like land use. That was new to the process.
I want to add one point in this, is to point out that in one of the slides you could see that there were 26 projects in this plan that were either kicked out or significantly changed because of the performance analysis. Now, in another plan in a previous year, some of those probably also would have been changed or kicked out. But A, the rest of us probably wouldn't know that. And B, I think that there would have been fewer of them changed. And some of those were ones that did come from the jurisdictions of the people who were on that board. And that was only possible to happen because there was both this buildup and because it was a performance process. It's talking about bang for the buck. All of the elected officials are going to talk about that. This was actually showing it, where bang was not just how many people moved, but also what's it doing to our health, what's it doing to our environment.
I sort of come back to the food nutrition label analogy, and maybe the public health people will correct me if I'm wrong, but that was really controversial. Does anybody remember when actually that came through as a, I mean, it was absolutely seen as you can't tell people basically what they're eating. And it's remarkable to think about that now, but in many ways, and what Dave said is important, there were, and I was on the early phase of this, there's really been 3 iterations of a planning process in this region in San Francisco. And in some ways, the early phase, when we first put out, here's how your project scores, it doesn't do very well, that were some of the more contentious debates. My sense is that what's happened now is people have sort of accepted the fact that they will be graded, that there will be grades offered, and even at this point, as Jeff said, the 26 projects actually didn't make the cut. That's a big deal.
Let me just add one other thing on this. I think that actually the most contentious part of the project performance analysis process was the deciding which projects were going to be analyzed. Because a lot of those elected officials knew that they had a dog of a project that they didn't want to be analyzed. And so, and we recognized that too. And so we fought probably the hardest in the process at that point. The actual analysis itself was A, done very well, and B, it's harder to put a thumb on the scale of the analysis itself. It certainly can be done, and I don't think that there was nothing of that happened. I'm sure there was some of it. But I think choosing what to analyze is really very important.
Other questions, yeah.
So what was the outcome of, say, a project that was a dog of a project, but it had voter approval back home? How was some of that worked out?
Everybody hear the question? What was the outcome of a voter-approved project that had to get rescoped?
So some of those projects that were dropped were voter-approved projects. Effectively, they're on hold at this point, right? So these are projects that are doing a planning study, and they're continuing to consider that project, but they can't construct it over the next 4 years.
Yeah.
I have a question about, I like how you categorized your performance targets as like whether they're infrastructure or customer related, and our agency right now is getting into target setting. So my question is pretty specific about the mortality rates you selected, and how often does that data come out, and is that responsive enough for you to be able to see the impact of the change?
There's really 2 issues here. So there's the measures you use to monitor your system, and there's the measures you use to evaluate in a planning process. And sometimes they have to be different measures because there isn't data available on them. We're working on our performance monitoring program at the moment. There are measures, they don't come out annually, but that look at issues related to health. And sometimes they are fundamentally have to be inconsistent with the measures that your modeling tools let you do. But if you try to link them up as closely as possible. And it's not common that they're going to match up perfectly, but you're still moving to the same planning goal.
You can tell I like analogies. So another way to think about this is if all your kids are in school, everybody gets to be in school from K through 12, and you get a grade, right? But you're going to be in school. Yeah, maybe if you fail, we'll talk to you about it. But if you go and apply to college, it becomes a very competitive. There are only so many spots available, and suddenly you've got selection criteria to basically determine how you're actually going to get in. And really what we're talking about here is trying to get into college, because there are limited seats available, there's limited money available, as opposed to the broader monitoring sort of out there in the external environment, which is also important. And it's also important to have those 2 things talk to each other. But there is actually quite a bit of confusion in this field about broader dashboard type performance monitoring versus actually using those criteria to score projects and put them into a plan. Somebody else, yeah.
PSRC has a special needs transportation committee, and which advises policymakers and staff on certain components of a lot of the planning. I'm wondering what the equivalent would be at MTC, and if so, what kind of input did those folks have on your performance measures and also on different key points during the process evaluation?
So we actually have two groups that are equivalent to that. We had a equity working group specific to this planning effort that was very technically oriented onto the measures themselves. And we also have something called a policy advisory council that gets at some of those similar equity issues into a broader group with more members of the public. We went to both those groups on a very frequent basis over the 1-year time span of doing this project evaluation. One of the interesting things, you saw the 10 targets, and then you saw the 5 equity measures. Those equity organizations really decided to, prioritize the affordability measure as the equity target. So when push came to shove, of those 5 measures, that was considered kind of the top priority. That made it into our broader range of targets, and then they had these complementary set of metrics. We went to these groups frequently. They were very involved in we shared all the, obviously all the results as well. So I think it was a very productive process. They were very happy, especially with the mapping effort that we did of the transportation projects. I think that was something new that we hadn't done in the past.
Okay, and per the agenda, we're going to wrap up this panel. I want to give another round of applause for Dave Vautin and Jeff Hobson.